So assessment's goal is actually to classify different behaviors, symptoms, mental challenges to be able to understand it and treat it. But there's actually three different ways that you can do classification. First off, there's the categorical approach. So the categorical approach is based on this idea that a person, a patient, is either healthy or disordered, and that there's no overlap. And this is where there's again this idea that you either have a mental illness or you don't, and there's not any gray area about it. So as you could probably tell by the way I'm talking about it, the categorical approach is not generally applicable. Most concerns, most problems of living are fall on a spectrum. So if you talk about depression, there's obviously a place where a person doesn't have depression and a place where a person certainly has depression, but we all kind of fall on a continuum of depression. And so while most of us are probably more towards the uh, less depressed, or hopefully that's the case, there's plenty of cases where there's a sort of a minimal or moderate level of depression, and that there's more severe depression. So what I'm talking about is more of a dimensional approach to classification, that you try to understand where people fall on a continuum or on a spectrum. And we know that we've done this with autism spectrum disorder, that we recognize that there's a spectrum of impairment that can go along with autism, where some people don't really seem to have much impairment. They have they have characteristics of autism, but they seem to be doing quite well. And then there's others who are not even able to communicate verbally. They're not able to self-care, and certainly that's more of a severe case. And so most mental disorders you should think about them dimensionally. So I encourage you to be careful anytime you get into this either or category of there's a yes, there's a mental illness, or no, there isn't. It's a dangerous and not entirely truthful way of viewing mental illness. Most problems are on this continuum. But there's a third approach there at the bottom called the prototypical approach. And this is actually the way that DSM-5 and all the previous DSMs have looked at mental illness. And there's this one's a little bit more hard to explain, but there's a conceptual entity that entails a combination of characteristics, or what we call symptoms. And there's a prototypical case of depression. And the person may not have all those symptoms, but if they have enough of them, then they'd be categorized as having depression. So for instance, with major depression, there's actually 9 symptoms. So depressed mood, lack of motivation, sleep changes, changes in eating, the suicidal thoughts, feelings of guilt or worthlessness, the I'm trying to remember fatigue, or feelings of being tired all the time, difficulty concentrating, and maybe I'm forgetting one more, but those are the prototypical depressed case. And you don't have to have all those symptoms. In fact, you might not have any problems with some of those, but if you have 5 out of those 9 symptoms, you get classified as having major depression. That's if you have those for at least 2 weeks, that's the way you diagnose major depression. So again, it's this idea, if you match close enough to the prototype, then you get the diagnosis. So most disorders, it is that kind of system that you're looking for. Do they have enough of these symptoms of a particular disorder to be able to diagnose them? So again, it's a little bit of a blend of the categorical and dimensional approach. Generally, DSM recognizes that there's mild, moderate, and severe cases. So there's an element of that dimensional understanding. But again, they're classifying as either you have this or you don't have it. And so it's not So that in fact is kind of the flaw of the DSM, is it is an either or way of thinking about mental illness.